The family dog was diagnosed with a tumor, especially in the complex position of the mouth and tongue. The owner will almost get stuck. To cut or not to cut at such an old age. Can you handle the anesthesia? Will it grow back after cutting? How do you know if it's working when you're done? Let's talk about our oxide knife ablation today. Provide a reference for this decision. You give the tumor a shot. 15 minutes to see if it's still alive. You don't have to wait a week. No need to wait for the pathology report. The dog is still on the anesthesia table. You already know if the shot is in place. It uses chlorine dioxide, a strong oxidant, the medicinal liquid directly into the tumor. Kill wherever you go. Right and go. Nothing happened at all. So the borders are particularly clean. No fever, no bleeding. Real cases of 4 dogs. Before and after photos. It's the same angle. It was taken during the same anesthesia. Case 1, Schnauzer oral tumor. So let's look at this Schnauzer. The tumor grew on the lower gums before the beating. Bright red drum. The surface seeps blood when touched. This is a typical live tumor. The blood supply is abundant. It takes 15 minutes to hit in on the anesthesia table. The whole tumor has coagulated. The color sinks. He stopped bleeding. There's a clear boundary between it and the normal mucosa next to it. Everything in the world has changed. The outside world didn't move at all. This case was later repeated a second time. Not because I didn't kill it the first time. It was the first time I didn't hit it at all. The tumor was irregular in shape. There is a piece of liquid that did not arrive. Die wherever you want. Where you don't go. Nothing happens. Case oral tumors in Chinese pastoral dogs. This pastoral dog has a bigger tumor, stuffed half of the mouth. He was bleeding all the time. Again, 15 minutes, the whole surface solidifies, darkens, bleeds. It stopped on the spot. Notice we don't have electrocoagulation. There's no suturing. There was no hemostasis whatsoever. Blood is its own. It stopped because the tumor's own microvessels were destroyed. This is very true clinically. Bleeding is the hardest part of oral cancer treatment. This method didn't cause it to bleed from start to finish. Case 3, Teddy's oral tumor. After this, Teddy is done. The color is not as dark as the first two. Brownish, teal, yellowish. This is not ineffectiveness. It's the tumor itself that doesn't have that much blood supply. There is less blood in the tumor. Less blood can be oxidized. You're not looking at depth. Is it the appearance or is it not? Living tissue. The surfaces freeze. Loss of luster and elasticity. The boundaries are clear. It's completely different from the normal tissue next to it. It's kind of like a piece of meat going into a pot. Color and texture change, at a glance, that it is not raw. Can't go back either. Case for squamous cell carcinoma of the tongue in mixed breed dogs. This case illustrates the problem best. A 16-year-old mixed breed dog, squamous cell carcinoma on the tongue is loose in texture. Very little blood supply. Enter at 2 after 20 minutes. The entire treatment area turns pale, yellow-white, solidified and hard. The boundaries are clear, and the unhit tongue next to it is still normal pink. It is still alive. It's barely turned black because there wasn't much blood in it. But it all happened. The appearance of interboundary living tissue is gone. The outside world was not affected at all. So that's the key to what I've been saying. It never changes color, and it's the tissue within that boundary that doesn't look alive. It's the same with a visible tumor. The current roads are like this. Surgery is going to be done to stop the bleeding too, so it takes a long time. The mouth and tongue are often cut uncleanly. Thermal ablation, radio frequency, microwave freezing. Relying on the temperature, the blood vessels, nerves, and oral mucosa next to it are heated together. Tumors next to important structures are not easy to do. Chemotherapy and oral medications. Systemic administration. When will the effect come out? Say no. Accurate. The side effect is that the whole body oxidizer at 15 minutes of anesthesia. Before you wake up, you will see the result. No surgery, no bleeding, no fever. The boundary is determined by the amount you inject. Not enough to make up an injection on the